Let's shift gears and talk health. Because if you are young and active, but you seem to be experiencing some sort of hip pain, well, then you just may be a candidate for hip arthroscopy. Joining me now is Dr. Matthew Hansen at the Core Institute to tell us that there are actually many patients that are living with undiagnosed, untreated hip pain, and they don't necessarily have to do that. Welcome to the show. It's good to see you.
Thank you, Stephanie. Thank you for inviting me. It's a pleasure to be here. It's true. Many patients have had hip pain for years sometimes and have maybe been misdiagnosed as arthritis or even undiagnosed and untreated when, in fact, there are treatments available for those patients.
Well, so we're talking about compromising quality of life instead of just addressing the cause of that hip pain in the young, active patients who, in fact, in many cases can benefit from hip arthroscopy, right?
Correct. You know, we've had the ability as surgeons to do arthroscopy for many years. Basically, arthroscopy is the ability to peer inside a joint with a small camera and perform surgery in a minimally invasive fashion. Now, one of the main causes of pain that in the patients that I see in my clinic is something called femoral acetabular impingement.
Say that again more slowly.
Femoral acetabular impingement, or FAI for short.
Okay, good.
Now, this is essentially where the bones of the hip are slightly misshapen. The femur is the thigh bone, and the top part of that bone has a ball. The hip joint is a ball and socket. That ball fits in the socket of the acetabulum, or the, as we see on the screen. And you can have two main problems with that joint. One is a pincer lesion where the socket is either too deep or tipped towards the back, and the other is a cam lesion where instead of the ball being round or spherical, it's more egg-shaped or cam-shaped. And what this causes is when the hip comes into a normal position throughout motion, those two structures actually pinch each other, and they can tear the labrum or delaminate the articular cartilage inside the hip.
It sounds painful.
It can be painful, and typically patients complain of pain in the front part of their hip, the area where your front pants pocket is.
Okay.
And it's not so much pain on the outside of the hip or even in the buttock region, but more in the front part of the hip.
Well, I want to jump ahead real quickly, and then I want to go back to some professional athletes. But I want to talk about, because you mentioned that bones that are misshapen can cause that pain. What causes those bones to be, I don't know, is it misshapen? Is that the right term?
That's a good question. And the most common cause for this cam, or this egg-shaped type of ball on the femur, is a stress fracture or a change in the way the growth plate grows on that part of the bone. And we can see that on these pictures. In this picture where the red arrow is, there was a misshapen bone. This is the labrum that we're looking at now with the yellow arrow, and this is the labrum after it's been cleaned up. This shows the large cam lesion by the star, and after that lesion has been removed. This shows you before and after that bone has been reshapen. And on these pictures, we see cartilage that's been delaminated and then fixed as we trim that rim and repair the labrum with those sutures.
Wow, okay. So let's talk about sports, though, because you know, it's football season now. We've still got some baseball going on. And as we kind of watch just the progression of the seasons, a lot of times we see these athletes and they're doing these minimally invasive procedures so that they can get back on the field. What is that all about, and how does that relate to the Core Institute? Well,
we have the ability with hip arthroscopy to do this surgery through 2 or 3 small incisions just large enough to insert a pencil. And what that means is it's outpatient surgery. You go home right after the surgery. You don't sit around in bed, and there's no bed rest. You actually get moving right away. You do your therapy the day after surgery, and we get you back on your feet right away. Most patients who have a procedure like a labrum repair of the hip can actually be back on the field within 4 to 6 months and performing their sport again.
Wow. That's quick for, you know, that type of injury, it would seem. Now, tell me a little bit about who would be the best candidate for this arthroscopy?
Well, these are typically young, active patients, and I don't put a strict age criteria on it, but we wouldn't necessarily perform this on somebody who has arthritis. And so, if you have significant arthritis in your hip, which can be determined with an X-ray, this may not be the best procedure for you. But if you've had persistent pain in the hip, which is oftentimes manifest as catching or locking, pain when you get up from a seated position,
those
pain
would be
getting
the
out of the
signs
car.
That we might be able to benefit from this.
Exactly. Those are very, very consistent with the labrum tear.
Oh, very interesting. I feel like I learned a whole lot. And the visuals are always a good indication, too, to see what we're doing inside. Fascinating. Thank you so much for coming on the show.
You're welcome.
We do appreciate it. The Core Institute has locations in Central Phoenix, Gilbert, Goodyear, North Phoenix, Peoria, and Sun City West. So if you would like to schedule an appointment with one of the fellowship-trained physicians at the Core Institute, the easiest thing to do is just give them a call, and that phone number is right there on your screen at 866-974-2222. 2673, and you can also visit their website at thecoreinstitute.com.